Hello people, I believe right now SHA is a name that everyone is quite aware of. You've heard the SHIF, the SHA, and I know as much as we are against the whole thing, there are so many people that need it and they want to know how it's working and everything under it and so on. So I decided to write a few notes to help someone. Also, if you're there and you have your grandparents in shags, just advise them how all these things are going, because these are people who have critical conditions and need attention. So the whole bill was enacted in 1st of October 2023. So right now there is no NHIF. We are all using SHIF. And the other thing is everyone is entitled to register with SHA, the Social Health Authority. And the first thing, if you want to register, just dial *147#. They have everything, like how the steps you're supposed to follow. If it's someone old, help them. The other thing, you can also visit the sha.go.ke to register with them. The minimum wage amount of money that you're supposed to contribute in SHA is 300. That is for people who are not employed. Someone who is not working or doesn't have a basic salary, or you don't have a business that you have that you are earning from. Secondly, if you are employed, your employer is supposed to pay for you the SHA, the Social Health Authority. Something else from your salary. If you earn, for example, 30,000, your employer is supposed to deduct 825 shillings. That is 2.75% of your salary. If you get 50,000, just do 50,000 off 2.7% of 50,000, and you see how much your employer is supposed to deduct from your salary to pay for you the Social Health Authority funds. Advantages of SHA from NHIF. There are a few that I've gathered is that they are saying that they are going to cover a few services that the NHIF was not covering. For example, screening health conditions and such as even cancer. They will cater for that. Consultation fee of your high-end doctor. They are saying they are also going to cater for that fee. Resuscitation. If you're in a critical condition and your person is going to get resuscitation, it's also catered. Stabilization, if you're in a critical condition, it's also going to be catered. Also, dental treatment, something that was not happening before, it's catered in the SHA. Emergency care, according to the bill, that is the Social Health Insurance Bill, is immediate care to prevent death. That is, you've gone with an emergency and that would have caused death, they will cater for that. Chronic condition, according to them, is a condition that has lasted for 1 year with each, and you're struggling, they're going to be catering for that condition 1 year or more. It's catered by the SHA. What else? If you're in a critical condition, that is something potentially threatening you, death, that can cause death in that moment, it is going to be catered by the Social Health Insurance. Payment method. If you want to pay for your social health insurance, just you're going to dial 200 and 222, and then account number is your ID number. And your ID number, they're saying you write ID, that is ID space, then the number. Then if you want to know the status of your SHA, it's 21101. If you want to know you are registered under the Social Health Insurance Fund, you dial 21101, then ID space, then your ID number. You can also use the USSD code, that is *155##3. And did I mention that SHA is compulsory to anyone living in Kenya? And if you're not a Kenyan but you're lawfully in Kenya, you are lawfully allowed to stay in Kenya, you're supposed to have your SHA. People who cannot pay their SHA also are the children under the age of 21 years. And also, if you're below 25, between 21 and 25 years, but you're still in school, your parent can still cater for your SHA. And that is, you have to prove that you're doing a full-time course in university that require you, that is, you're not working at all. So below 25 years, your parents can still cater for the SHA. Someone else who will not pay the SHA is someone who has a disability and is dependent on the contributor. That is, you're paying for someone who cannot work at all. They have a disability that does not allow them to be active in any way. They're also saying that someone else who can, or the spouse of the contributor, you can contribute for your spouse. And I've mentioned children under the age of 21 years. Basically, I think that is it. And if you have something that you can also add to help someone, you can tell me down there in the comments that we can help someone to register for the SHA. I believe, as much as we are against this whole thing, there are people who are really suffering. There are people who are in theaters. There is someone who is about to give birth and they are not sure, like, how is this whole thing going? Is it going to cater for my whole delivery thing? Yes, it does. I have someone who was delivered through the SHA and they have catered for everything, all the basic, even cesarean section. They are saying that they are going to cater for that. So pay your SHA. I know, because it's a bill that has been passed in the parliament, so it is actually active and it has been enacted. So as far as you can say, this is something that we should just embrace as for now, for the sake of our health and for the sake of someone who has a condition that requires this SHA. And adios.